Good afternoon and welcome. Let's take a look at the top story we are tracking for you. Europe is battling a fresh wave of the COVID-19 outbreak. Several countries are reporting record numbers of cases. The European Medicines Agency has said that Europe must close the gap on vaccinations in order to stop the surge of COVID-19 cases. The warning comes at a time when hospitalisation is increasing among unvaccinated people. EMA Vaccine Strategy Chief has said that some European countries have unacceptably low vaccination rates.
We are seeing an excessive number of cases of COVID, including severe COVID and hospitalisation or admission in the intensive care unit, particularly in the unvaccinated. We should not forget that still in many member states there is a large portion of the population, including subjects at risk above 50 years of age, that are not yet vaccinated, and they are the ones that are most likely to go to the hospital and suffer from the consequences of severe COVID-19, including mortality.
The body has warned that countries should take additional steps to stop the virus from circulating during the winter season. This comes after it highlighted that no vaccine is 100% effective. EMA is yet to make a decision on whether to approve the Pfizer-BioNTech vaccine for children from 5 to 11 years of age. Let's take a closer look at how European countries are dealing with the rising cases. Starting with Germany, authorities have agreed to implement tough restrictions on those who are still unvaccinated. They will be barred from restaurants, sporting events, cultural shows. Germany recorded more than 65,000 new cases on Thursday. Local leaders held talks with German Chancellor Angela Merkel on how to deal with the situation. They have made it mandatory for unvaccinated people to provide a negative test report before using public transport or working from offices. Moreover, it is now compulsory for healthcare workers and employees at elderly homes to get vaccinated. Merkel has called the situation highly dramatic and one that calls for consistent action.
The situation is highly dramatic and it will be very important that action is taken quickly, that action is taken consistently, that controls are improved. And then we will have to observe whether we can stop or at least reduce the dynamic. With the current dynamic, we are running into a very, very difficult situation, especially for all people who work in hospitals and especially in intensive care. We have always said that we do not want to overburden our health system. We know that we cannot achieve this overall.
Meanwhile, in Switzerland, Health Minister insisted that new COVID restrictions are not necessary. This despite the nation witnessing quadrupling of COVID-19 cases. Elaine Berset said that we are facing the fifth wave and the course of the pandemic will depend on the behavior of all of us. At the moment, the virus is spreading among younger people who are less likely to get seriously ill. However, according to Berset, the situation is worrying as the number of adults who have no immunity against COVID-19 is too big. Now, in recent months, Switzerland has witnessed a sluggish vaccination drive. Authorities are trying to increase the vaccination pace. Around 65% of the Swiss population is fully vaccinated. Switzerland recorded nearly 6,000 cases on Thursday alone. Greece has also introduced more restrictions on those who are unvaccinated. Those who are refraining from getting a jab will be banned from restaurants, cinemas, museums and gyms, even if they test negative for COVID-19. Vaccination certificates for those above 60 years of age will be valid for 7 months. This is to encourage the elderly to get booster shots. On Thursday, Greece reported more than 7,000 COVID cases and 63 deaths. In a televised address to the nation, Greek Prime Minister Mitsotakis has urged Germans to get vaccinated.
From next Monday, all adult unvaccinated citizens, in addition to catering, will not enter other indoor areas, not even if they carry test results, in cinemas, theatres, museums or gyms, for example. It is an immediate act of protection and, of course, an indirect entreaty to be vaccinated.
Now, for more on this story, we are being joined by Ryan Thompson from Frankfurt. Thanks for being with us. Now, what is leading to the surge in cases in Germany specifically and Europe in general?
Well, if you look at the situation in Germany, it was a calm situation over the summer. They managed to really escape from this fourth wave of the virus by handling it in a calm manner. We returned to normal life without much of a surge that we saw in neighboring countries like the UK or France, which face a much different epidemiological situation. But in fact, now we are facing this fourth or fifth wave, depending on how you look at it, because frankly, everyone is returning indoors. There is a massive surge of cases because everything had calmed down, but now you see that slight group of unvaccinated people coming inside as well, and that's really boosting some of these case counts, providing a much complicated situation as well. And you have these handover cases where people who are vaccinated and with the virus have no clue that they're passing on the virus as well and transmitting it to other people.
Right. Ryan, why has the vaccination rate been so sluggish in Europe?
Well, it's something that's interesting, and we've really taken a deeper dive looking at a lot of the Germanic-speaking countries. There's something in the culture of Austria, Germany, and Switzerland where the vaccination rates seem to be really quite stubborn. They're not to get over that 70% benchmark rate. A lot of people account it to the politics of these countries where people are hesitant to take a vaccine that is so young. They're hesitant to take a vaccine because of the personal politics that they hold. And this is an interesting point here because we're really just not able to get over this point, but it's a contributing factor to why these three nations in particular are seeing a massive winter surge so early on in the winter as well. Because if you look at other countries which have really struggled to get through this pandemic, you can look at Italy, you can look at France, they are doing fine. I mean, case counts are rising as we get deeper into the winter months, more people indoors. But in these countries, it's a more severe situation because the vaccination rates just are not where authorities want them to be.
Right. And what has been the policy of the nations when it comes to booster doses in Europe?
Well, booster doses have been a real patchwork of policies, right? So here in Germany, and as well as France and Italy, they were effectively and technically rolled out on September 1st. But actually getting that notice to some of the older populations, the populations who are at risk on September 1st, didn't seem to happen as smoothly as when we were talking about getting those first and second doses, those key doses in this situation. So it's been a really complicated situation to at least get those initial booster doses for the populations who are really in need of it. Now we are facing the question of, okay, what do we do about the general population? And that's a more complicated situation. For example, here in Germany, it was actually the choice of the health minister to go against the official health committee's recommendation, where they took some time to recommend a third booster shot after 6 months to the general population. They seem to have adopted that mindwork now, but it was about 2 weeks ago when the health minister, Jens Spahn, decided that despite this recommendation not being in place, he wanted to see the general population coming in to get this third booster shot because he thought it was critical in order to prevent a massive new wave of the pandemic.
Right, we'll leave it there. Ryan, thank you very much.
WION, now available in your country. Download the app now. Get all the news on the move.